So I know that you are a psychotherapist. What does psychotherapist do, Dr. Diana?
Okay, well, psychotherapists do many things, but based on my experience, I think what the public can sometimes not be aware of is a psychotherapist, which deals with mental health, is different from a medical doctor, which is dealing with medical or biological health, physiological health, if you will. And what I mean by that is, if you go to a medical doctor and say you have a cough, well, the medical doctor can examine you and say, okay, you have a cough because you have the flu. And so you take this antibiotic and maybe you do this, and within a week's or so time, you're fine and life goes on. But mental health is never that easy, okay? People can't just come to me with a certain issue, problem. I can't just say, stand on your head, run around the block and drink orange juice and you'll be okay. There's no easy answers like that, because mental health has many, many different layers to it. And so they may come in with a surface issue that they're experiencing. Perhaps they hate their job. Their boss is a nightmare and their colleagues they just can't get along with their colleagues. Well, that's a very surface issue, which usually has a lot more layers to it, and it goes back to their innate personality and preferences, how their innate personalities and preferences have come to be based on past relationships, and even going back to families of origin, early life experiences, that all have something to do with what is making their present experiences at the workplace unpleasant for them, And so there's no fast and easy answers when it comes to psychotherapy. Things have to be looked at in a very holistic fashion, and that takes time. As I always tell my patients, it's a marathon, it's not a sprint.
Lovely. Thank you. My other question is, so somebody discovered that he or she needs your service. So how do you handle a patient?
Okay. There are many different theoretical orientations and modalities to psychotherapy, okay? Myself, I operate from what is known as psychodynamic psychotherapy, okay, which is also known as depth psychology. So again, I am looking at more deeper layers, not just what seems to be the presenting problem or issue, but what else is going on with this person. What is their innate personalities? What are their past experiences that all culminated together that is making whatever the presenting problem is an issue? I'm also a certified dance therapist and expressive arts therapist. So I also patient dependent, because there's no one size fits all in here. But I use many different modalities in my work other than just verbal therapy. But again, it's all patient dependent and what is right for the patient.
Thank you.